Hi, I'm Dr. Rajdeep. I'm a dermatologist and dermatosurgeon practicing at Charma clinic attached to Chirag hospital in JP Nagar 2nd phase, Bangalore. As we grow older, our skin develops many changes and this is more common after the 30s. So first thing you may notice is the skin might start becoming more dry. So those who have oily skin tend to have good skin for a longer time unless they have lot of acne scars. Then the second thing you might notice is that you might start getting more deep wrinkles, especially by late 30s or by early 40s you start getting more deep wrinkles. So wrinkles are seen around the eyes, we call as crow's feet, then this we call as frown lines when we frown like this, then we have forehead lines here, and these are all can be corrected by procedure using something called a neurotoxin. So neurotoxin is small injections which are given into the muscles which cause these wrinkles. That relaxes the muscles and gives a relaxed face. Otherwise sometimes people look angry, even if they are not angry they look angry or they look old because of wrinkles. Then there are other areas, especially in Indians, the first thing we see with aging is under eye hollowness or dark circles. So this area starts becoming more hollow under the eye. So we use something called a filler to replace that hollowness. So filler is a gel-like substance which is injected into that area and fills up and gives a smooth look. Sometimes fillers can be used for lifting the face as well. So as we grow older, this may be seen in 50s. So as we grow older, there is drooping of the fat of the cheeks. So this area might droop, this area might droop, this cheeks might droop. So we use fillers even for a lifting effect. So then what about the superficial layer of the skin? So these are all procedures which we do for deep layers. So for the superficial layers we do simple procedures like peels. Peels give regenerated new skin. It regenerates skin at a faster rate, reduces oiliness and reduces pigmentation. So peel is one of the simplest procedures done in almost all clinics. Then another little more sophisticated procedure for those who have a little sensitive or dry skin where we can't do peels, or those who want quicker results without much downtime, because in peels there is actual peeling of the skin. It may not be visible but there will be some dryness and the skin is more sensitive to sunlight. So if patient does not want this, we do something called as laser toning or carbon peel. So in laser toning or carbon peel, it helps to reduce the pores, reduce the oiliness, give a smooth tone to the face and reduce the uneven pigmentation on the face. Then there are certain other procedures like mesotherapy and PRP. Usually mesotherapy and PRP are used as add-on to other procedures. So if you want to give good hydration to the skin, mesotherapy is injection of products like vitamin C, hyaluronic acid, etc. in between the layers of the skin. So this stays for a longer time and gives a good hydration and it gives a nice shiny skin. PRP is similar to mesotherapy, where platelets from the patient, platelets are a type of cells which are extracted from the patient's blood, and you might have heard in dengue fever platelets go down. So platelets have lot of growth factors naturally produced by the patient themselves. So these natural growth factors are harvested and injected into the skin. Earlier platelets themselves were injected and this was known as PRP. Now we do something called growth factor concentrate injection. So GFC injection we call that. So GFC is again it's derived from PRP itself. So this gives a more natural look and similar effect as mesotherapy, whereas the cost is much lesser than mesotherapy, because mesotherapy we are using products, whereas PRP we are using patient's own blood. Also side effect using external products or artificial products are not there with PRP because it is made from your own blood. So these are some of the common procedures that are done in late 30s and early 40s.